Diet did it. Research all avenues before you go under the knife. There's a good lesson.
Right then.
Hello, hello. So, I didn't think I'd be revisiting this again. But there is some news, so I thought I'd do a part 6 of my Rezūm story. If you've been following, you'll know that I had my Rezūm procedure July 2022. And as you can see in part 5, it wasn't a good ultimate result. We know there are no guarantees, but I was disappointed. I was really disappointed. I got a really good result initially. So I'm going to say about 6 weeks after I had the procedure, there was a very good result. The urine flow was really good, really powerful, and I thought, oh, great stuff. And then very quickly it deteriorated to a very poor result. And so I was left with about, I'd say about, I don't know, 10 to 15% better off than before I had the procedure. That was it really, until about 6 months later. What I did was I contacted urology in my local hospital, and the poor result was confirmed by another eye-watering cystoscopy. And if you've had a cystoscopy, you'll know what I'm talking about. Really not comfortable at all. In fact, I'm just digressing a bit. My first ever cystoscopy was about, I don't know, it was about 10 years ago. It had nothing to do with my prostate. It was something to do with my bladder that they didn't like the look of. But there was nothing wrong. But I remember the urologist, I'm laid on the trolley, and the urologist placed this, what looked like a large stainless steel tubing on my thighs, which made me extremely nervous because I could see the thickness of it. And, and to calm my nerves a little bit, I thought I'd had a little bit of humour, which went straight over his head. I just said, mate, I goes, that's not going to fit. And with that, and with not even smiling, he just said, oh yeah, it will. And turned out it did. But he had to use some bloody force, and I was in agony. But anyway, like I said, I digressed. And the next two that were for me prostate was nowhere near as painful. The tubing didn't look half as thick as that first one. Anyway, so going forward, so I'd had the cystoscopy. The poor result was confirmed by the urologist at the time. He said the lobes were, I actually saw them on the camera that he was using. He said, he pointed them out to me, and you'll know what I mean. The lobes either side of the prostate, you could see where they were just coming in together, and he said, yeah, that's where your problem is. Look, it's not that they'd grown back. I mean, they didn't have time to grow back. It was just a poor result. I got an initial result, and then it just disappeared. And so anyway, what happened was, when I had the Rezūm procedure, I'd only just started what they call a carnivore lifestyle. So it's the ultimate elimination of inflammatory foods. That's what that is. And so I continued this, and I'm still on it. Actually, I'm on a very, very low carb lifestyle now, and I introduced a tiniest amount of carbs for a reason. It's because of my zero teeth. I was just getting stuck for choice, and it was doing me head in a bit. So I just wanted to add a little bit more flavour, and now I've got a few more food choices. For instance, you know, my origins are Italian, and I do love the Italian style meatballs, but on a pure carnivore diet you can't eat them because of the ingredients. Well, I just relaxed it a bit, and I feel much better about everything now. But anyway, so after being on the elimination lifestyle, cutting out all inflammatory foods, which are essentially, I never had seed oils anyway. Don't ever use seed oils for your cooking, ever. They're toxic. Do you know what it was originally made for? Oiling down industrial machinery. Now, do you want to use that for your cooking? Do it at your own peril. Anyway, so I never used them anyway. I've always used butter, and sometimes I used to use olive oil, but not now. It's just butter and ghee, and I make my own ghee when I feel like it. But other than that, it's a very good quality butter, Kerrygold butter I use. And absolutely no carbohydrates. So I cut out the inflammatory foods. And lo and behold, within 12 or 15 months, my prostate reduced massively in size. And how I know that is because what a great surprise. I have a blood test probably every 6 months or so, 6, 7, 8 months. And my PSA, which had been steadily rising, there was no danger. I'd had it checked out with MRIs, and actually agreed to a biopsy at one time. I wish I never had. That's another story. I'm not going to digress again. But anyway, my PSA numbers came down from 12 ng/ml, which stands for nanograms per milliliter of blood, in the UK anyway. Convert this to wherever you're watching this from. So it came down from 12 to 3 in 12 to 15 months. No medication whatsoever. My PSA numbers had been up for several years. And when I say several, I'm talking about probably about 8 to 10 years. It was steadily rising. And when I started to really worry about it, it was up at 7 and 8. And every year there was another point added to it until at my last very high reading, like I said, it was 12 ng/ml. And then all of a sudden, there you go, it dropped to 3. So it could only have been the elimination diet. So imagine how much inflammation that was in my body regarding other medical issues. So what a fantastic result. And I'm always going to be either very low carb or carnivore. I'll get my new teeth in my brand new teeth in January. I'm having this done in Budapest, and that's another story. I've already had one visit. I'm having my second visit in September and my third visit in January, which is when I'll get my teeth. Now, I'm really looking forward to a lovely ribeye steak. And so I've just got to be patient. And who knows, I might go back to full carnivore, 100% carnivore in January. I don't know. I probably won't, you know, because now I just realise that, you know, I want to eat certain Italian foods. Of course, I'm not going to start reintroducing things like pasta and rice and potatoes and bread and cereals. I'm never going to do that. They are so unhealthy, so bad for you. Do your own research. Don't take anybody's word for it. Do your own research. So bad, so inflammatory. Anyway, I'm just so pleased at the actual Part 6 final result of my prostate that I'm feeling very comfortable again with it all. Instead of having them worries in the back of your mind, you know. So, yeah. So I only really eat once a day. So I'm just going to talk a little bit about my food. I only really eat once a day, and what I mean by that is my meal, it's very heavily meat based. And if you just look back at my previous, instead of me fully explaining, just go back to one of my recent food videos and you'll see what I cook in bulk. And then I have that once a day. I add a couple of eggs to that. And I also add one of my lovely Italian meatballs to that as well. And so I have that at 5:30. And I also have reintroduced one pot of Lavazza coffee. I'll show you the size of the pot. So there's the pot. There's my Bialetti pot. It's a percolator. It's an Italian style pot. And so that does me, I have, it's not a full cup. Full cups you get out of there, you get sort of, I'm getting sort of 2 3/4 small cups out of that. I have one in the morning and I have one after my dinner after 5:30. And that's it. Whereas before, when I was full on with that coffee, I'd have 2 pots of that per day, plus whatever coffee I'd drink while I was out and about on my bike doing my exercises. I'm never going to go back to that again. 1 pot will do me. And so that's what I eat in the evening. And in the morning, the only reason I have something to eat in the morning is because I'll take a few supplements to try and help the circulation problem that I have to my legs. It's called peripheral arterial disease. Well, I've been trying to manage that for many years. That was self-inflicted as a young man. I was completely addicted to cigar smoking. And when I say addicted, I was 20 a day and chugging it down like a spliff. I packed in 15 years ago, but the damage was already done. Plus back then I was a competitive powerlifter and bodybuilder, and I used to eat about 8 times a day. And I had no idea about nutrition. Nothing. I knew nothing that I know now about nutrition. So it was very high sugar foods that I was consuming. And so I truly believe that I was an undiagnosed type 2 diabetic. That's what I believe. And I think that contributed to damaging my arteries as well. I firmly believe that. But, you know, there's no point crying over it. like I said, minimal amounts of food, but enough food and enough nutrition to keep me healthy these days. I've got no bloat on me whatsoever. Before, I mean, I'm 5'6", but I've got a quite, as you can see in my other videos, I've got quite a decent frame, muscular-wise. And that's just because I've been training all my life. But I used to think my normal weight, because of my muscularity, was sort of, you know, 168, 175 pounds body weight, and I thought that was healthy for me, and that's when I was eating still a lot of carbs. But I soon found out, once I dropped the carbs and became much healthier because of it, my body found its own weight, its natural weight, and now I fluctuate between, I'll do this in kilograms and pounds, okay, so I fluctuate between 68 to 70 kilograms, which is 150 to 154 pounds, and that's my healthy weight. My body's happy at that. I don't do any gym training any longer these days. I'm 65 years old. Also, you can see this on my channel. I do a couple of dumbbell circuits in the house, and then I'll go out on my assisted bike because of my circulation problems to the legs. There's always a workaround. Don't throw the towel in because you've got physical health problems. All right, there's always a workaround if you look for it, but you have to be positive about these things. And while I'm out on the bike, I'll always stop off at my workout area and do my pull-ups and body weight hangs, press-ups off the seawall decline. You can see that it's on my channel if you want to have a look. And so my total training per day is about 15 minutes, and look at my body composition. I know it's fantastic, and that's without being a big head. The body composition is fantastic. So it's about nutrition, more so about nutrition than exercise, but you have to do a little bit of resistance training, I would suggest. But it's more about nutrition than anything else. And the guidelines have fooled you for years and years and years, and they've brainwashed you, and you think your fruits and your vegetables and your potatoes and your rice and your bread is all healthy. It's not. It's slowly killing you. That's what it's doing. And I would suggest, as I said earlier, to research this stuff for yourself before it's too late. Look at the obesity around the world. Look down any street. Look at the kids today growing up. It's normal for kids to be obese. When I was at school, the fat kid at school stood out like a sore thumb. Now it's the norm. Sad but true. Anyway, if you've got any questions, I know I digressed a little bit, but if you've got any questions regarding nutrition, about the elimination diet, about carnivore diet, about my great result regarding my Rezum, then, you know, feel free to ask. Oh yes, I forgot. And very, very importantly, what's the ultimate result with my urine flow? Good question. Forgot all about it because I was jumping from one to the other. Right, so As you can see in part 5, I probably got a 10 to 15% improvement. And now with the elimination lifestyle and diet, if you want to call it a diet, it's not really a diet at all, it's a lifestyle. I would say it's not brilliant, but I will say this. Just give me a sec. I'm thinking 100 things at once. I've got about, from before having the Rezūm procedure, I would say I've got about now about a 25 to 30% improvement. I can live with that. Had it been like this before I was researching a prostate procedure, I wouldn't have gone in for a prostate procedure, because I can live with a 30% improvement. So there we are. Diet did it. So, you know, we live and learn. Research all avenues before you go under the knife. There's a good lesson. All right? All I ask is that you like and subscribe. Okay? So, bye for now, and thanks for watching.